Welcome to Mazars Healthcare Digest. We're going to discuss medical practice key performance indicators. And my name is Marc. I'm a partner at Mazars in our accounting and advisory group. And I'm here with Jacki Jacox, who's a director in our healthcare consulting group. Jacki, I'm going to turn it over to you.
Sounds good. So as Marc mentioned, we're here to talk about the key performance indicators of a medical practice. And here's a slide just talking about our agenda. We're going to go overview of performance indicators, give you examples of medical practice KPIs, and then also go over a KPI dashboard and what that looks like, and then a snapshot of a disposable income analysis. So first, let's start with an overview of KPIs. The purpose of KPIs are to help management evaluate practice performance in a meaningful and efficient manner. And really, the idea is that they provide management with a high level snapshot of practice performance versus a predetermined set of targets, objectives, or industry benchmarks. And so, really, the idea is that you can quickly have a view of how your practice is doing and maybe areas of focus. Marc, have you had any ideas on where you typically see within these areas what practices tend to struggle with?
Yeah, I mean, usually, Jacki, when I explain the importance of KPIs to my clients, medical practices, and larger organizations, I usually like to break it down and just have them understand that without measurement, you can't have any management. Okay, and KPIs are key to kind of keeping on track, right? You don't know when and where you're steering off course or where there's issues in the practice. I like to call these issues profit leaks, if you would. And profit leaks aren't necessarily things that you can look in, look in and evaluate simply in your financial statements. Okay, that's where a lot of this information is going to be coming from, but KPIs gives you an insight into the different areas of your practice that you may have to work on, right? By kind of ringing the alarm, hey, there's a problem here, or there's an issue here, there's something further to look at.
Absolutely. So now we're going to go over a couple example medical practice KPIs. Of course, there's many out there. These are just a few key ones that we feel are really important for practices to focus on and are key to success for practices. This first one, as Marc mentioned, profit leaks actually is an essential formula, and it's the net collection percentage. And I usually think of this as how much cents you are collecting for every dollar you're allowed. And it's very different than just looking at your charges minus all adjustments like write-offs. It's looking solely at what you were allowed to collect based on your payer contracts compared to what you actually collected. And so in this example I'm showing here, you can see that there's a downward trend for this practice and their net collections, which means that they should really start to pay attention since it dropped below that 90% benchmark. Because usually I like to say that 90% or higher means you're doing pretty well for collecting what you're allowed to collect. Once you drop below that 90%, you should really start thinking about, um, if you're auditing your billing practices, that would be a great place to start looking to see if you're following up on your denials and such. And Marc, what else would you recommend for profit leak review?
I mean, some of the additional KPIs that we're going to be looking at, but yeah, this just sounds the alarm the minute you're dropping below a threshold that's acceptable to you as a practice. We usually, like you mentioned, recommend around 90% and above as a good collection percentage. I'll also preface this with it's very important for this and the rest of the KPIs that we're going to be looking at to make sure that the data that is being collected is good data, because that old adage, garbage in, garbage out. So it's also important to make sure that the information itself is being entered properly. And that's something that's very important to check with regards to the whole revenue cycle, which we'll be discussing.
Absolutely. So in a fee-for-service world, relative value units are the key driver of practice collections. And so benchmarking them against your peers is key. And it's something that we recommend doing at least on an annual basis, if not quarterly. And in this example, you can see the practice year over year is improving in how they're benchmarking against their peers. And because work relative value units are the key driver of practice collections, that's why it's important to pay attention to it.
Jackie, I think it's also important to note that this is also a key driver when figuring out certain physician compensation arrangements.
Absolutely.
Because I sometimes find that, some physician practices, they don't really hone in on the RVUs, really have a full understanding of how it works. But I mean, a good way to describe it is you could have two different insurance companies that may be reimbursed differently, and you could have two doctors that are working just as hard as each other. One may see better collections than the other simply because of the way the reimbursement is working, yet they're working the same and they're both working as hard and contributing to the productivity in the practice. And the work RVUs, I guess, is a good way to measure equality, right, within the
Yeah,
practice. Is a good way to
absolutely.
describe it. Sure.
That's great. Yeah, and I would say this is especially with physician comp, it's key, and we're gonna touch a little bit on physician comp too later. Here's a payer mix analysis, and payer mix is a review of collections the practice receives by payer contract and how much it makes up of total collections. And in this hypothetical practice, they have a diverse payer mix, which is about 60% public payers and then 40% private and commercial payers. And the reason why it's important to benchmark it is although it would appear the practice has an unfavorable payer mix because the reimbursement you're going to get from public payers is less than you would get from private or commercial, they are right on par with their peers when you look at survey data. So it's just something to think about as you see how you're comparing to your peers, because maybe you need to go out and try to find more commercial or private payers and target a different population if you're seeing that yours is off base compared to the rest of your peers in the specialty. Mark, what else would you like to add
Yeah, I
for
mean,
payer mix?
the pair mix is something that's really good to analyze, and I'm gonna bring it into, and again, this depends on the type of practice, whether it's a specialty practice, a family or a general practice may work a little differently. But I'm thinking in terms of potentially like an orthopedic practice. You want to engage in that, I hate to say it, that 80/20 rule,
Mhm.
at the end of the day, and what's impacted and is very relevant in this industry. Medicine has become a business, and depending on your type of practice, you want to focus on your highest payers, so to say. And if you're spending a lot of time on Medicare and it's not reimbursing enough your efforts, it's really your own, it's really your decision as to whether you want to continue to see Medicare patients, or it could be any of the other commercial payers if they're not paying well enough. But and you can focus your time on other companies that are reimbursing you better. This really, from that standpoint, this really needs to be analyzed and analyzed more frequently. Or it may also prompt you to try and renegotiate some of your
Yeah.
contracts, and get some higher rates if that's still possible. It really depends. A lot of factors go into, whether you can or cannot be successful with that.
Yep, absolutely. And we have a whole payer contracting team that does that for this exact reason
Yeah,
because, it's
it's a
important.
Yeah, it's a good point, Jackie. I've
Um,
engaged them to actually even come into some of my smaller providers, and they've actually encountered some good success with renegotiating some better rates.
so this next benchmark is an example of a hypothetical medical practice, and it's a hematology oncology specialty. And in this hypothetical example, we compare on the left side their practice top 10 CPT codes and their volume and how much percent it makes up of all their procedures. We then compare that to the right of survey data benchmarks and what those top procedures are. And really, at the end of the day, this benchmark, the purpose of it is to see how you're coding compared to your peers. And it's really a great snapshot to look at to say, am I in line? And in this example, 9 out of 10 of their CPT codes were in line, which is great. And it means that they're billing about what you would expect. Now, the mixture of it was a little bit different, so they could look into that. But truly, the important part here is making sure you don't find that you're either way above or way below coding at different levels. And Mark, I know you can have a good example of different scenarios if you're billing way above or below.
Yeah, we several years back, it might have even been about 10 years ago, we were doing a rev cycle analysis of a gastro group. And one thing that caught our eyes, they were for the most part coding appropriately. There was certainly some opportunity for higher coding with some of the physician partners. But then there was one particular physician partner that kind of caught our eye because most of his coding was on the higher side, a 4 or 5, and we just brought it to their attention that you just need to make sure that your documentation, right, can support some of those
Absolutely.
higher coding practices. We don't encourage it. You kind of, I when I discuss this with our healthcare attorneys, and sometimes we present together, think of the bell curve, right? The 1, 2, 3 is at the top, 4, 5. You kind of want to be in that mid range as far as good billing practices. It's certainly fine to bill higher, but just make sure that your documentation supports the higher billing, because it's been too often we've seen the insurance companies come in and do a chart review, and all of a sudden you end up with an issue that you really don't want to have.
Absolutely. That's key. Coming down to the documentation at the end of the day is what really matters when supporting your CPT code billing.
I'll tell you, just as an aside, that's where, with the onset of EMRs over the
Hmm.
years, it's been a good thing, but it's been a catch-22,
Right.
because to get the proper backup in a patient's file, what they also zone in on, and we've seen this as well, is the cut and the paste. The cut and the
Hmm.
paste. If your notes are too alike on multiple different patients, the insurance companies will pick up on that as well.
Oh, absolutely. That's a good point. So this next one we want to talk about is the accounts receivable aging. So many medical practices report their financials on a cash basis. So accounts receivable I've seen is often left neglected or unmanaged, but reviewing your accounts receivable reports often is essential. And there's many different benchmarks in accounts receivable that's important, as such as like days in AR. But this accounts receivable example is benchmarking out your aging buckets. And the breakout of the aging buckets will vary based on the medical practice specialty. But I really like to compare this to survey sources, because then you can see, are you in line with your peers? Are you doing better? Do you need to improve? And typically, what I've seen is the more profitable medical practices will have more than 85% of their AR collected within 0 to 90 days. Once you start to get into those later than 90-day buckets, your chances of collecting is a lot slimmer. And so really staying in that lower bucket range is ideal. Mark,
Yeah,
what have you seen with AR? Yeah, I was gonna
yeah,
say.
yeah, it's great. Listen, the AR and your billing. This is where it begins and ends with your practice. It's the most important aspect of, other than obviously providing patient care, but it's the most important aspect of your medical practice and kind of what keeps it going. Um, One thing I want to point out with the accounts receivable and the aging is just the write-off practice, or rather, I should say, write-off policy. Who's in charge of writing off aged accounts receivable? Is it, if you're handling it internally, Is it your billing team internally? If it's over a certain amount, do they have to come and double check with the physician owner or somebody in a position of authority or higher authority for the practice or who's in charge of the practice's finances? If it's an outside billing company, also, are they double checking with you before they write things off? I say this because, especially with an external billing company, they get paid based on collections at the end of the day, unless there's a flat fee arrangement, and sometimes we see that, as well. And certain states will mandate that based on the corporate practice of medicine. But they're getting paid for their collections, and so what becomes unattractive to them is chasing after that aged accounts receivable. And if they have a free hand to kind of write things off, that improves doesn't improve, but that can impact certain categories, as far as their speed of collecting receivables in general, the amount they collect, within a certain amount of time. If it's certainly something that you should have almost a written policy, I would say, around who is eligible and who has to approve write-offs.
Yep, absolutely. So this next one is shifting over to the expense cycle, but providers need to understand their cost structures to eliminate excessive costs. And so the overhead expense percentage is a great one. You're looking at total operating expenses minus your provider salaries and benefits. You divide that by your total practice collections, and then you get to your overhead percent. And Marc, what do you typically see for overhead percent for practices?
It's a good question, Jackie. We obviously, there's benchmark data out there, and it will take a look at percentages, overhead percentages as a whole for practice, and even for certain line items or grouping of expenses based on geographic location as well. But depending on the type of practice, I could see a range of overhead percentages, from a specialty practice, maybe an orthopedic, or a plastic surgery practice, where I might see 30 to 40% overhead, upwards to an internal medicine practice or a family practice. You might see more like 50 to 60. I've even see as high, sometimes I'll see as high as 70. If you're
Yep.
seeing over 70, that again, the alarms start ringing. Hey, what's going
Yep.
on here? What? Now, look, certain practices may have high overhead. Maybe there's a lot of cost of goods sold with particular drugs. I've seen circumstances where just providing allergy shots is kind of a break even for some of the pediatric practices. But you want, for a healthy overhead percentage, I would say you want to see in the 50 to 60 range, 55
Yep.
being, optimal. Wouldn't you say, Jackie?
Yeah, that's exactly right.
Yeah.
I saw a benchmark the other day that said the typical medical practice overhead is now in the 60 to 70% range, and I agree. I mean, I would like to see them under 60, if not under 50, because really you just want to make sure at the end of the day that you're not getting excessive in costs and eliminating unnecessary expenses.
Yeah, 100%.
So this last one that we wanted to talk about is physician compensation, and it's always important to look at survey reports when you're looking at your percentiles and where you're paying. Now, of course, when you're a physician owner, which in this example, um, you're going to see Dr. A is the owner, and so they're going to have shareholder distributions, and so they're going to end up well above the 90th percentile in a lot of scenarios. But the key to understanding this is your employed providers in a medical practice. You have to be paying them within fair market value. And that just has to come along with the Stark Law, anti-kickback statute, the False Claims Act, as well as the IRS regulations. And just in the fiscal year 2020 alone, the Department of Justice recovered over 5.6 billion from False Claims Act cases, and that was the second largest annual total in history. And so a lot of this had to do with cases of inappropriate provider compensation. So it's always essential as a physician practice to be looking at where you benchmark compared to your peers and how you're paying. because it's very important to make sure that you're not getting inappropriate kickbacks or just having arrangements that aren't reasonable. And there's just so many important things to physician compensation to make sure you really understand all the ins and outs of making it reasonable so that you're incentivizing the providers to appropriately consult with their patients. Let's look at a couple medical practice examples of dashboards and snapshots. This first one I wanted to just share is a medical practice dashboard. And a lot of these KPIs on here are what we've talked about in our presentation. And the idea here is it's just really a great tool to have management have a quick look at how am I doing? Let's look at our benchmarks. And it's supposed to be something that can be relatively quick to pull together. And it's just supposed to be a quick comparison of where am I at.
Now this is where it begins and ends, right?
Right.
This is, and for the physician owners of a practice, this is the best thing to look at,
Yeah.
as opposed to going through a lot of the detail in the financials, which they don't always necessarily want to do. This kind of pulls it, really kind of pulls it all together, and it'll sound the alarm in different areas that may require a deeper dive. And so, we sit down with our clients and drill into any problem areas that need to be addressed, or this is basically letting them know, hey, we're moving along, we're growing at a certain pace, we're up, this year, hey, we added that new provider in the
Mhm.
practice, and here's what's happening. So I love this, this one slide, the dashboard.
Yeah. Mark, I'll let you talk about this one. This is
Yeah,
an
yeah, I love. So
example.
this was kind of a homegrown worksheet that I had put together. Very often, um, I'll get the question, and Jacki, where I'm coming from. Hey, how much am I really making? Right? Hey, I
Yeah.
earned $1. What am I taking home? Where is the money going? And so I kind of created this worksheet to kind of break it down. And what you could see is it starts with the practice gross income, and then it captures all the practice expenses. However, in those practice expenses is the salary of the physician owner. In this case, this was a one shareholder physician. That was his gross, and those were the practice expenses. It came down to the practice net income. But to give him an idea of really what did he make and what is he taking home after taxes? They always want to know that. We added back his salary. He makes a pretty sizable retirement contribution. We add back some fringe benefits, um, and we arrive at what I would call our adjusted net income. Those were his taxes that he paid. I net those out, and I come up with net disposable income. So the 1.488, almost 1.5, that basically was his take home after everything, after
Yeah.
practice expenses and after taxes. To bring it home, the bottom section is really a check. Here was the practice income. Here is really where the practice expenses were net him. So his practice expenses were net his salary were about 37%. Okay. And here again is the practice adjusted net income, tax liabilities, and there's my proof. So
Yeah.
for every dollar he was making after practice expenses and after his tax liabilities, he was bringing home almost 44%, which is not a
Yeah.
bad day at the track by any means. This was a well run practice. We implemented a lot of procedures and systems in this practice. It was pretty tightened up, and it really ran like a well-oiled machine. You could always do better, okay, and everybody strives to do better, but this really brings it home for them as far as, hey, how am I really doing?
Hmm. Yeah.
And
I think this is great. You, I feel like physician owners, the number one question is always, what am I taking home at the end of the day? And what does that look like after taxes, right? So I
right,
think this is
100%.
great. That just concludes our episode of our Mazars Healthcare Digest and talking about medical practice key performance indicators. We've included here our QR code, so if you scan this using your phone, you'll be able to pop up our business cards and contact information. So please feel free to reach out to us. We're here to help you, and This is something that we love talking about and love helping with. So thanks again for joining.